everyone, welcome to another educative and informative session on health checks with Dr. Memstic. Last week we talked on the prostate cancer in men, and this week we're bringing to you another interesting topic, but this time around I'm coming for the female gender. Yes, we're talking to you, the women, the girls, and the babes. What we'll be talking about is very interesting, so listen up and come close. I have information for you. Like I said earlier, you know, ignorance is not bliss. So get here, let's discuss. So today we'll be talking about cervical cancer. I guess you've heard of cervical cancer, or if you haven't heard of cervical cancer, I'm here to provide you with all the information and create the necessary awareness that you need to know. Cervical cancer is a cancer that affects the cervix. The cervix is the lower and narrow part of the uterus, what we call the womb, the lower and narrow part of it that connects to the vagina. Cervical cancer is cancer that affects that part of the female reproductive organ. Like we all know what's cancer. Cancer means that the cells of that part of the body, now the cervix, grows abnormally and grows out of control and may spread to affect nearby organs and tissues. Cervical cancer is the fourth most commonest cancer according to World Health Organization globally. And in Nigeria, it is the second commonest cancer in women. And the interesting thing about cervical cancer is that it is one of the cancers that can be easily preventable and can be easily treated. Yet, so many women are dying from cervical cancer because of lack of awareness of what you can do to prevent cervical cancer and the screening methods you need to carry out in case you are at high risk of developing cervical cancer. So now we are going to delve into the cause of cervical cancer. The main cause of cervical cancer is infection with a virus we call human papilloma virus. 90%, if not more, of cases of cervical cancer has been linked to persistent infection with the high-risk type of human papilloma virus, what we call HPV virus. This is a very common virus. And how is this virus gotten? It is sexually transmitted. And just skin-to-skin contact with someone who has that virus puts you at risk of picking it up. And it's interesting to let you know that most people, 80% of women, at one point in time in their lives have come up with HPV infection. But the good thing is that because of our immunity, our immune system, the body's ability to fight and resist infection, the body has a way of clearing off this virus, and then it doesn't cause any symptoms. You move on and life goes on. However, there are a certain group of people in which this virus may persist, and as it persists over time, it causes changes in the cervix, that narrow part of your womb that leads to the vagina, causes abnormal cell changes there. And over time, if these cell changes are not picked, it can develop and become cancerous, malignant over the years. So, HPV virus is the main cause of cervical cancer, and there are various strains of over 100 strains of this HPV virus. However, it is the high risk type that puts one, if you have persistent infection with this high risk type of HPV, are more likely to come down with cervical cancer if it is not picked up early. HPV does not just cause cervical cancer alone. It also causes cancer in men too. Penile cancer, the commonest cause of cancer of the penis, penile cancer, is HPV virus. And remember I said it's a sexually transmitted virus, meaning that a man can give it to a woman can give it to a man. And then it also causes what we call genital warts. There are people who have abnormal growth in their private parts, in their vagina, you know, some abnormal growths like that, warts. It is HPV that causes it. HPV also causes cancer of the throat, even cancer of the anus. So this virus causes a lot of cancers. But the interesting part of it is that you can get vaccinated to prevent this infection with HPV. So that's it on the cause of cervical cancer. Like I said earlier, HPV virus, persistent infection with HPV virus. What are the risk factors? What puts you at risk for cervical cancer? And how can you be screened? What are the symptoms that you should look out for if a woman has cervical cancer? How can we prevent it? What are the treatment modalities? Watch out for this information on the next episode on Health Checks with Dr. Memstic. Thank you.